But I would again like to thank you for joining the Senior Circle today. We've got a great discussion around the Healthy Brain Initiative roadmap, and I am going to introduce Melissa Smith with Tri-County Health Department and let you take it away, Melissa. Thank you so much.
Super. Thank you so much, Joe. And gosh, what a great group. I'm so excited about this conversation. Thank you for spending some time at this meeting to have this conversation with me. My name is Melissa Smith, and I work at Tri-County Health Department in our Community Health Promotion Division. And I'll just start with a little bit of a nutshell about how we got to this place. So I work with a team of people who are really passionate about equity and about aging populations and how health departments can contribute to work that is happening in our communities. And I think I saw Laura Dawn and Emma Goforth here today, so they are part of that team. So thank you for being here. But last summer, we learned about a grant for health departments to increase organizational capacity to address Alzheimer's disease and related dementias. And with a strong letter of support from our local Alzheimer's Association chapter, thank you, Rosalind and your team, Coral and Kelly. We were one of 8 health departments selected across the nation to be part of a first cohort for this funding. And so the funding came from the Alzheimer's Association, the national office, and from NACCHO, which is the National Association of City and County Health Officials. But it really supports implementation of strategies between now and the end of November. So November 22 is when the funding cycle ends, from a document called the Healthy Brain Initiative Roadmap, which is a collection of 25 different strategies and ways that health departments can engage in this work, with a focus on education and awareness, on policy work, on workforce development, and on monitoring systems. And I shared that background really just to highlight that it is not our aim as your local health department to create new programs or services, but it is our aim to amplify resources and expertise of local partners and to be able to model how local health departments can integrate helpful strategies into existing workflows. So we know, for example, in our service region, which through the end of this year is Adams, Arapahoe, and Douglas counties, that Alzheimer's disease is in the top 6 leading causes of death. It's number 5 in Arapahoe County. We know that numbers are on the rise. They're expected to increase, as you all well know. We also observed in our initial data scan as part of the grant that in the 3-county region that we serve, 1 in 5 hospitalizations that was related to Alzheimer's disease were for people under the age of 65, which really speaks to the significance of younger onset dementias, which I think may not always receive as much attention, but are certainly present. And so we aren't the experts yet, but we know that you are the experts in aging populations. And so we just wanted to have a conversation with you today. And let me also mention, we've also learned that you may be aware, the state of Colorado is working with an advisory committee to develop a 5-year plan to address Alzheimer's disease and related dementias in Colorado that will be coming out later this year. And so we know there will be a lot of opportunities to align and connect once that becomes more available. But today, again, the goal was really, as a local health department, we want to hear from experts in the aging field to help us start a conversation for our learning. There's no wrong answers. The only intent is to help us learn. And this is, gosh, such a big group. Let's start, if we can, just a quick show of hands if you're comfortable, or button hand thingy on the Zoom. If you have been impacted in some way, personally or professionally, by Alzheimer's disease or a related dementia. And I'm seeing almost all the hands go up. Gosh. Yeah, so it is a condition that affects all of us, and it impacts people differently. And again, just thank you in advance for the conversation we're about to have. I've just got a couple of questions prepared that if you're comfortable, I'd love you to just unmute and answer, and you may need to take a minute to think about. I've also got these questions on a Jamboard that I'm going to insert the link into the chat box if you'd prefer to put some information in that way. But with that kind of quick nutshell history, in your experience, what are some key points or nuggets of wisdom that you wish the general public were more aware of related to older adults and aging populations? And I'll open the floor back to you. No pressure. What will happen, I think, is I'd just like to listen and learn, and this is just a step to, I think, really acknowledge how much happens in our community and how much wisdom and expertise there is already, and to capture a little bit of that. So as your local health department, we can try to amplify some of that. So the question is, in your experience, what are some key points that you wish the general public were more aware of related to older adults and aging populations?
Melissa, I have something I'd like to share.
Yeah, Susanna, thank you.
Hi, I'm Susanna Hart. And so in my profession, what I do every day, again, I'm a licensed clinical social worker. So I do emotional support, psychotherapy with older adults and caregivers. And there is a misunderstanding, and this is specific about dementia, really not just general aging, it's specific, but it is my my vocation, my line of work, that there's a big misunderstanding with folks about dementia and that it's a mental health issue, and it is not. They can certainly overlap and entangle. No pun intended about tangles and plaques and such, but there's just a lot of stigma that remains with both with aging in general, with mental health, and with dementia.
Thank you for that. So do I understand correct? So that dementia is maybe sometimes misinterpreted as a mental health condition and
Right.
not recognized as maybe an early stage of dementia.
Right, and that dementias are a medical condition. People can tend to, whether it's the individual who's diagnosed or their caregiver, can tend to kind of blame themselves, if you will. Oh, there's something wrong with me, and if I were just, stronger or healthier, or if I could just pull myself up on my own bootstraps, type of misconceptions.
Thank you for that. And Shirley, I see your hand up.
Yeah, I mean, this doesn't really have to do with dementia, but just more about older adults, which evidently that's me now. But I think in a lot of the industry, in the senior industry, there's a lot of misunderstanding who we are now, who older adults are now. We're kind of still being treated like my father's generation would have been. I find it really interesting when I walk in a senior living community and I'm looking around, and a lot of those people that are in there are maybe, 10, 15 years older than I am. And they're playing music that my father would have listened to, right? They're interacting with them more like my father's generation. So I think there's been a generational shift in older adults that's not being recognized.
Thank you for that.
I think that, kind of to Shirley's point, they tend to lose their value for whatever reason. And I mean, every time we lose a senior, we lose so much history, we lose a lot of value. So I don't think that we value seniors the way that we should.
Thank you. And feel free to just call out. I can only see a few people, so I don't know if hands are up. So feel free just to unmute yourself.
I would just say that that key points I feel that would be helpful is just some basic points for those of us in the community dealing with folks with dementia, just to how to effectively communicate. And Rosalind does a beautiful job with community education. They feel like, you know, elevating it to a place where the general public has that awareness, just like as part of their muscle memory. I mean, I feel like it's such a big issue that we need to be at that place where people know how to, you know, handle it when someone's with them who's experiencing dementia.
Thank you, Sheila. Harvey, do you have your hand up?
Yes, I do. This question is for you and also the Alzheimer's Association. I'm recently recovering from COVID, and I spent over almost a month in the hospital. And I'm 67 years old, and I have children. And one of the big things is I'm not seeing, you know, I went to the doctor and they said, well, and things are coming on TV about memory loss and certain people having effects in the brain that's lags on after COVID. And I wonder if there's any information on COVID and Alzheimer's and dementia, you know, happening. And if so, for the families, you know, we need to at least have a discussion and get that information out to them, because there's going to be a lot of concern over the next few years about, you know, the pandemic and Alzheimer's, because they might relate in some way. And I don't know, I could be kind of off base, but it's a question I definitely, if I can get answered or any pointed in any direction to find some information, I would appreciate it.
Harvey, I'm glad you said that. This is Jeannie Davis speaking. And just the other day on one of the news channels, there was a report about the brain and how some of it, in some cases of the COVID, those who had COVID, some of them the bodies were examined and they found some brain damage there that could lead to Alzheimer's. And Roz, I don't know whether your organization has seen that or that information or not, but I'd sure like to get some more information, because I think that ties directly to what you're saying.
Absolutely. Thank you, Jeannie. And Harvey, my friend, I'm glad you're recovering. I haven't seen you in a while, so hugs to you. And thank you for raising that question. There is definitely a connection, and I will drop a couple of resources in the chat. There's more research being done around inflammation and how it's impacting the brain. And as a result, unfortunately, of the detriments of COVID-19, it does definitely exhibit inflammation, from what I understand, that impacts the brain. And then, you know, we've heard of long haulers. And I know I have a couple of friends who are still recovering from long haulers. So yes, to answer your question, there is a correlation. So I'll share that. Thank you.
Thank you
Amanda,
all for that. Yeah. Go ahead, Jo.
Sorry, Amanda, I see you've had your hand up there.
Yeah, I think that what I wish people knew, understood, considered more frequently was that exploring options and choices for what you may need in the future well before you need it is exceptionally powerful. Those individuals and adult children who have the mentality of mom and dad are fine, we'll cross that bridge when we get to it. By the time you've crossed that bridge, you've passed up some options that you can't go back to anymore. And so having those family discussions, understanding what someone wants, understanding what they think they might need in the future, what they might not think they will need in the future, but may anyway, to open up the points of communication a whole lot earlier between generations and, you know, exploring those resources. Communities will have you tour long before you need to move into that community, and other resources are happy to give you information long before you're going to need it, so that there's not a crisis decision being made, but instead a path you've already laid out that you can follow if and when the time comes up.
Thank you. Great point. Sasha, do I see a hand?
Yeah.
Yeah.
So relating to what I wish, I guess, everyone knew about older adults is, I think that often older adults are maybe they're not given credit for who they are and their knowledge and their wisdom. They're underestimated a lot. And like an example of this, and this was just really powerful for me, I think it was a commercial I saw, might have been a Facebook commercial, I'm not sure, but it showed an older adult woman and she looked like really, I guess, more feeble, and you could just tell she had declined. But then in the mirror, it showed her in like a nurse's outfit, and it said something like her accomplishments when she was younger. And I think about that a lot. People don't, they do underestimate the knowledge and the wisdom in the past that some of our older adults have. They have amazing stories. They have just a lot of experience with life. And I think often they're just underestimated.
Thank you for that. Patrick.
Here we go. I just wanted to mention in the with the population that I work with, specifically with technology. First off, I find that having patience and empathy are key to doing what I do with the population that I work with. But I also think that they're just generally speaking, oftentimes we hear about people having to have the talk with an older adult, but maybe it's about driving, for example. But something that folks may not consider is that you may need to have the talk regarding technology. Sometimes there is a need to think about setting up some guardrails just to keep people safe. I'm talking about things like phishing, social engineering of various forms. It could be through things like online dating. It could be anything where the older adult person is vulnerable or potentially exposed to fraud. So just having the ability to establish some guardrails and create a safe environment for them to interact with the online world, but do it in a safe manner. Thanks.
Thank you. Y'all, this is such great conversation. Thank you so much. Adriana?
Hey all, let me come back here. Can you all see me? Checked out.
Yep, we can see you. If you could just speak a little louder.
It might be my headphones.
Hello? Okay, sorry. I can speak to some of the pieces that I usually see with people that come through our case management program. One of those is public benefits information. There isn't enough information out there. There's lots of questions. There's lots of things that are needed. Waiting too long to access public benefits. Public benefits take time to establish. It does not happen quickly or as quickly as we would want them to happen. Not having necessary documents in place, right? So do we know where mom banks? Is there a POA in place? And having some of those other conversations as well. And then things like that obviously affect our decision, right? So sometimes I have clients that don't want to pursue public benefits because of very real things like Medicaid estate recovery, where the state of Colorado, again, this is a federal program, right, can come and take your home. So you can't leave your home to your children, which is what a lot of people want to do with their home. And I guess just general access to just within that world, because once you need that level of care, right, what do you do? And if you can't provide it, then that's your option. But yeah, I just see people just not having these conversations early on. I love the paid caregiver program because I have seen some great caregivers, but I have seen some paid caregivers that don't do what they were supposed to do, like administer medications or take clients to doctor's appointments. So, I mean, there's just a couple of things that I've seen particularly, but the big one being the public benefits piece conversation and those type of programs.
Thank you for that. Thank you very much. I'm going to move on to the next question, but I think we'll leave this Jamboard open for a few days. Should anybody like to come back and include anything that hasn't been added? This is, gosh, I'm a little bit amazed by it. It's just when you ask the question, the response, it just tells me that we need more people asking these questions and more people learning from you and your expertise. So, but our next question that we'll move to, and you may need to reflect on this for a moment then, is do you have any reservations or again, nuggets of wisdom about an organization like Tri-County Health Department engaging in this realm? Because it hasn't, an organization that really hasn't been engaged in this work before and is fairly new to the work. When we certainly have staff with different levels of expertise organizationally. Do you have any words of wisdom or words of caution or concerns about kind of a newcomer?
I would just like to ask a question. This is Jeannie Davis. Why is Tri-County going into this arena after so many years?
Fair question. So Tri-County, I've been with the organization for about 8 years. When I started, they had a fairly robust aging division that was involved in a number of efforts. And some of you may have been involved in the start of that, most notably the Fall Prevention Network. And when I became involved in aging work, it was with our Matter of Balance fall prevention programming. And that was pre-COVID. I was doing that for a little less than a year before COVID hit. Post-COVID, our role as a coordinator for that did not survive the pandemic. I think we have, again, we recognize the importance and the impact of aging populations, and we have a staff who would very much like to be able to promote that work. We don't have funding to do programs or services specifically. So for us, it's really looking at how can we learn from our community partners? Are there things that we can do really to amplify the work that you're doing to make sure that our staff and the general public know about resources that are available, to make sure that when we do get asked questions, are we able to point people toward the most reliable and effective information that's available as a health department? So it's really, I would say it comes from a good place, but we also, I know, acknowledge, I mean, some of our questions for this is, for some of our responses, I think, to this question are about, we want to make sure that we're not replicating something that's already happening. We want to make sure that we're not giving the impression that we have expertise where we don't. We want to be sure that we're serving as a connector to existing resources. I don't know if that completely answers the question.
It does indeed. Thank you.
Okay.
There is a comment in the chat, Jennifer Roy. Did you want to say your comment or question, or you can put it on the Jamboard if you wanted to do that?
Yes, thank you, Joe. Can you hear me?
Yes, we can.
Okay, great. So in regards to the previous question, Melissa, I'm the director of sales and marketing at Juniper Aurora, and I've been experiencing a lot more prospects with the diagnosis of alcohol dementia that I feel a lot of people don't have. It's just a different diagnosis than Alzheimer's and dementia. So I think to be more aware of that disease would be very beneficial.
Thank you. Any other thoughts for a newcomer to the field?
I think I would mention, and I say this as both experience professionally and personally around dementia, is how challenging it is to even know what the entry point is to resources. I think that's a huge challenge, is where does one start? And I think someone mentioned it earlier, sometimes you don't even know what you need until something is happening, until you're in that situation, and it's a critical or an urgent situation, and it's very overwhelming for a community member to now all of a sudden suddenly now be thrust into the caregiver role and need to plug into resources, and it's very overwhelming to know to where even to start. And so I think there needs to be a lot more work around what does that look like? Where would I go? Luckily for me, I had made a lot of contacts throughout the years. So, but for someone that doesn't, I wouldn't even know how that person would start. Where would they even go? Would they call the public health department, and would they be the ones to say, well, here's where you need to go? Or, so I think that is a huge piece, is just where does a person even start if they need to start looking into resources?
I think that's a great point, Joe, is, as a lay person and not knowing all the things that a lot of you know and a lot of us know, it's so overwhelming. And even knowing when, I think at the point of diagnosis, honestly, these individuals need to be told, now you need to connect to something, right? Whatever that is. Because, the reality is, like several people have pointed out, people wait until there's a crisis, and then they're in crisis mode trying to respond to the crisis rather than, having some information going in and maybe having a better idea of what to expect and where to go when things start happening.
I think piggybacking even on both of those is that it's important for those people thrust into that position to know that their situation is unique. And that just because their cousin kept mom home doesn't mean that's the right decision for them and for their older adult. And just because their neighbor placed dad somewhere in memory care doesn't mean that's the best decision for them. And that, there's enough guilt going on within their own head without comparing themselves to everyone else. Each caregiving situation, based on the knowledge and the experience of the caregiver and the life experience and the diagnosis of the care recipient and the supports around them or not around them, each situation is unique, and they should not feel the need to compare themselves to other people they've heard about in the same situation, because there's usually enough variables that it's unique, so they can walk their own path and find their own support for that path.
One thought on this too. So sometimes this is also what I see where people are first diagnosed and they want to get that long-term care Medicaid. And I'm like, you can't get it yet. Unfortunately, the disease has to progress. It has to take its toll, but until that independence is no longer there, until that safety is no longer there, we can't do much, and they don't need help right at this point, but it is very much the time to start having these conversations, start thinking, start planning, which is great. I appreciate the enthusiasm sometimes with families, but I'm just like, I can't do anything yet. We can have some conversations and call us back, down the line when you start seeing these things, or when this happens, or, when you're starting to have these other needs. But yeah, there's definitely conversations, and there's definitely, when is the time? And it really is just so personal, right? Because the disease sometimes can take a while, and sometimes, few months later, and we're having a completely different conversation. So it is absolutely different for everybody.
I think maybe a related point to what you're saying is you're speaking to people where it's maybe too early for that step that you would be able to help them with. But we often see people where they feel like independent living in a community like Cherry Creek would be a good fit for the stage they're at, because they still are able to socially interact appropriately. They're still able to dress themselves appropriately, get to a meal perhaps, but they're definitely showing signs. And it is not uncommon at all for these individuals to have no advance directives in place. Like we're going, who is power of attorney in this situation? They don't have one. And I don't think we're probably unique. I imagine other people who are in senior housing and services see this as well. So there's this other piece of heightening our awareness of us all getting those advance directives in place. So people who love you and care about you can help facilitate the process. Even if you become resistant, if a physician then says, okay, I can make this diagnosis, then those caring individuals can start helping guide the course.
Thanks, Sheila. Molly, I see your hand up, and I saw your comment in the chat around success with VA for eligible veterans with an Alzheimer's diagnosis. Did you want to?
You faded out and I can't hear what you're saying. So, but yeah, no, I've just asked about, did anybody have any success with the VA? And Sandy Morris gave me a number. I've become a caregiver for the kid's dad. And I think my two observations are that young people, the kids are losing their father, which is very different than me caring for it as ex-husband. And I've, like you, been in the field for a long time, so it's not that big of a deal, but it's very difficult watching the kids suffer through losing their father. And it seems to me that if he's the one with the Alzheimer's diagnosis, that his benefits, his insurance, his caregiving team, which doesn't exist, but if I got one, when I figure it out, that they would be responsible for caring as well for the children and help, they're young adults, helping them be understanding of what Alzheimer's is for their father and what it means. But it all comes down to me, and it's a difficult dynamic. And Alzheimer's doesn't seem like the same diagnosis as a broken leg. Yep, I got a broken leg. I'm going to be disabled for a couple of weeks. Give me a ride. And it affects the family, it affects the caregivers, but not that much. But when it's a situation that changes the personality, it seems like a caregiver system should look at the whole family and different impacts.
Thank you for sharing that.
I just wanted to add, as a case manager, it's challenging because every family member is at a different place too, of what they're willing to accept, what they're willing to see. So it makes it very challenging, even finding that time, to get that power of attorney, get that stuff done before they're too far gone. I mean, some people are on board, some people aren't. The more kids they have, the more complicated it gets. So it's, again, I guess back to education, but sometimes people they don't want to believe it, or they don't want to move forward, and that stops the whole train from moving.
Thank y'all for that. This is such powerful conversation. So thinking about, I'm just imagining all kinds of opportunities for future conversations and future learning. Are there organizations, we've got a large group here serving in Arapahoe County, that maybe are not represented here today that you would recommend as an important community asset for this kind of a conversation? We got a pretty good group. I see Care Patrol.
Public libraries hold memory cafes, which I recommend to anybody, but there's all the memory cafes are usually hosted at a library location of sorts, right? And they also have different, I think there was another, what was it? Denver Public Libraries did some dementia training not too long ago too. So those guys also do some trainings as well. But the libraries are a great resource. I mean, just regardless.
I would also say Aurora Center for Active Adults.
Okay.
And then the larger communities, we have Heather Gardens and Heritage Eagle Bend, whether, they offer a lot of programming that I think that the older adult population who's, keyed into them is looking for. So I think they could be valuable to have at the table.
Thank you. And Sasha?
Just to piggyback off of what Sheila mentioned, I think in every community, just about, there are active adult centers or senior centers, and the ones that I have worked with are wonderful resources, and they have a lot of things that they offer. They offer like groups for people that are dealing with Alzheimer's, the families. They just, I don't think you can say enough about those active adult centers. They're amazing, at least the ones I've been involved with.
Thank you. Shirley?
Yeah, I mean, I was going to say like the Malley Center specifically. That's a rec center for older adults in Arapahoe County. I think it would be beneficial for you to reach out to the Arapahoe County Council on Aging. And do you, I'm sorry, do you serve like Jefferson County too? What was the other county?
We don't serve Jefferson. It's Adams, Arapahoe, and Douglas through the end of this year. And then each county is setting up its independent health departments.
Okay, so I would say reach out to ACAN, Adams County Aging Network, and the Douglas County Senior, what do they call themselves? I can't think. Yeah, Douglas County Senior Circle? No, that's not what it is.
They have a senior aspect of their public or their health.
Right, yeah.
Their government, I should say. But I think it's Douglas County Seniors. That's what they refer to the group as. And then there's Aurora has the Aurora Commission for Seniors as well. And the commission members, they've always typically had a representative who attends the Arapahoe County Council on Aging meetings. So, you know, those advocacy groups would be good as well.
We do have
a
member
Douglas
that
County Senior Center, I think, would be a good place to start.
And we do have a member that participates in those ACOA meetings. Her name is Barb Schnellner. This is Jeannie Davis with the Aurora Commission for Older Adults.
And Barbara's a resident at Heather Gardens.
Oh, perfect. Perfect. And I want to thank everybody. I'm seeing some things that have gone into the chat, some other suggestions, to thank all of you for that. And again, our role at we're kind of looking in then internally with our advisory team, wanting to be informed by community, given, you know, between now and November, what are some things that we could do to, for example, you know, staff development for our own workforce to plug in some of these things that have been identified by this group would be really valuable, and to be able to model for other health departments how this work can be integrated, even if there's not funding to do programming or services. So this has just been such a helpful and eye-opening conversation. I think you all have captured such a broad range of feedback for us to consider. And if there's interest, I'd love to be able to kind of share our end of year summary of learnings with this group, if that would be helpful in thinking about opportunities to partner with new health departments, you know, in the years to come. So I know that Joe, you have there's some other things on the agenda, so I don't want to take up too much more time, but I just again want to say thank you so much. I'm so appreciative.
No, not at all, Melissa. We have a few extra minutes if before we get into a little networking, but if anyone has any other thoughts or ideas that this has brought up for you, please feel free to speak them or put them in the chat. I know one thing that's come up for me, and there was a report recently around incarcerated folks who are seniors and who are then no longer incarcerated, but really struggle to connect with services and maybe whether it's health or, you know, care, really connect with care. So that's something that kind of made me kind of came up in my thoughts, is looking at that. So, you know, we're going to try and address that at one of our senior circle meetings, but just another thought around, you know, accessing care really. And what does that look like if someone, you know, doesn't really have a lot of support to begin with, and they're having issues, maybe they're starting to show signs of dementia. What does that care and support look like? How would they access care? You know, how does that work? So that's what came up for me, but what other thoughts? What other thoughts do folks have? And
I think, sorry, Joe. I think accessing resources has been something we've been talking about for a long time, because it is very difficult. There's all these resources out there, and there's all these different ways to access it. I think it would be a good conversation to have again, because there have been some little changes, I think, around that maybe we want to bring to light, like I think it would be very interesting to find out how people are getting their information, to find out, from the people that are actually having these experiences, like, where did you go? Where did you start getting your resources? I think that would be very interesting. I don't know how we'd get that information, but I think it would be an interesting conversation.
It would probably be valuable to have someone from Dr. Cog's Aging Service Division in the mix, because they do have their information referral line that they manage. Is that the 211? I think anyway.
It's connected with 211.
Yeah, and I certainly I'm sure they have some data analytics about the numbers that call in and what their call requests are related to. So it'd be interesting, I think, to see how many people use that as an entry point for trying to identify resources. I know when I was at the Center for Active Adults for many years, we kept the Senior Blue Book on the rack all the time, just to offer people, a good, resource book that would have like everything from soup to nuts, so to speak. But, I don't know if you're someone looking for services or support for dementia, if that would, it's certainly not the only thing, but it's like, I feel like this demographic that we are speaking of, I've always felt like they are most comfortable with a hard copy of something to look at, more than, it's not to say they're adult children who are working with them on this, but many people, I think, do want a resource piece that they can thumb through, as well as those online resources.
Right, I agree, Sheila, I really do. And I think it's also important to recognize that there's a fair share of folks that don't have family support, that are out there trying to navigate this stuff alone for the most part.
Well, we've got a few minutes left. Thank you all so much for your input. I wanted to leave some space if you wanted to come off mute to either ask some more questions of each other, if you want to announce something that's going on in your world, an event that you have or resource you'd like to share. We'd love to know about it. So feel free to come off mute. And I wanted to just say a special thank you to Melissa for this conversation and for these questions. I think they're important. And, again, maybe we could have you back, Melissa, and do it again, or if you have follow-up questions or whatnot. But I think this is, really, really helpful to hear all of the ideas and thoughts. So thanks, everyone. And Jeannie, I see you're holding up your Aurora Commission for Older Adults.
I am, Joe. We have established a relationship with the Aurora Public Libraries, and we're using the Mission Viejo Library as a pilot program to start doing some things around intergenerational support. So we're having an event that is on the 22nd. That's on April 2nd at 10 a.m. at the library, and we'll serve bagels and coffee and things like that, light snacks for breakfast, so that you can get to meet the members of the Aurora Commission for Older Adults. Last year, we were successful at changing that name from Aurora Commission for Seniors to Older Adults. So if you want a flyer and you want to distribute a flyer to others, then just reach out to me. I'll put my email address in the chat, and I'll make certain that you can get some flyers, or we will have a supply of them down at the ACAA, the Aurora Center for Active Adults as well.
Thanks, Jeannie. And if you'll email the flyer, we'll put that in our follow-up email that goes out as well.
Great.
That'd be
Thank
great.
you. Mhm.
And Deirdre, you have your hand up.
I do. Maybe that helps. Sorry,
There
they
you
gave
are.
me a new background, so it's kind of weird. I don't know if I like that. Anyway, Deirdre Callahan, I am a professor at the University of Colorado School of Dental Medicine, also a previous AHA board member, and also on a few other of the committees. And I just wanted to mention, this is my first time joining this group, but the reason that I really flagged this meeting is because at the Anschutz campus, we have this really cool new program that we're doing, and it's called COSIT. And the acronym stands for Connecting Students with Older Adults for Televisits or something like that. So it has nothing to do with dental visits or medical visits or anything like that. So what we've done is with the School of Medicine, School of Pharmacy, the School of Nursing, and the dental schools, we put together this project that started right before the pandemic or right at the beginning of the pandemic, because we were noticing that older adults were becoming more isolated and feeling more loneliness. And so this started out with this cool little idea of like, well, why don't we have our professional students connect with the older adults and maybe make a phone call once a week, or maybe even Zoom, something like that, just to like check in. Again, no medical, this isn't a health visit. It was just like, oh, well, tell me what did you do? Did you ever volunteer? What kind of things did you do? Or what are some of your favorite memories of a best vacation? Just a connection, a person-to-person connection. So this has grown pretty big. So we're now in 7 states. Because people have heard, and so maybe someone in Aurora told their sister who's in Minnesota or something like that. We even have people in Hawaii. So unfortunately, this time, one of the parameters is not with older adults with dementia, because our students just don't have the skills for that at this point. But I've made it part of one of my courses for the dental students. So in the beginning of the fall semester, each dental student will be paired with an older adult partner, and they have to connect and they have to learn about that person. And it teaches so many things, right? It's helpful for the older adult, maybe decreasing some of that isolation and loneliness, or just wanting to connect with someone. But it also helps my students in that they're learning how, one, to cold call, to make a connection, because that's what they're going to be doing every 45 minutes of their day, connecting with a stranger, and also to learn communication skills, what works, what doesn't work. And so we guide them all along on how to do that and work with them. So that said, it's grown so much that we need more older adults. And so I thought this is the perfect group. So I'm going to see if I can put this in the chat, but also I will send the link to how, if you have older adults in your life or in your agencies and organizations that may benefit from this becoming part of this program, there's a consent that they have to sign. Therefore, that's another reason why older adults with dementia and that type of thing, we're not ready to do that. But so there's a way for them to sign up, and then let me just put this in and then take any questions that you might have about it. Here it is. So there it is. And then Mandy and Joe, you guys can send that out as you need to as well.
Yeah, we will. Absolutely. Thanks, Deirdre. That's awesome.
It's a
What
really
great
cool program. Yeah.
Cool. The second thing I want to put out is now that we are kind of moving more towards a normal time, our dental students, we would love to get out into the Aurora community to provide some educational
lessons, maybe even do some screenings for older adults. So contact me if your organization would like to have something like that.
Thanks, Deirdre. Great. Sasha?
Hi, thanks. Tiny background about me. I recently left North Metro Fire Rescue District, so it's a fire department that serves Broomfield and North Glen. And with them, I was the community outreach and risk reduction specialist, and I worked primarily with the older adult population there. And I taught a lot of fall prevention classes and gave a lot of presentations about fall prevention because it's such a big issue with our older adults, and it can be really devastating. And it's something, especially in the fire service, we see all the time. About 2 weeks ago, I joined on with Nimble, and they hired me primarily as a boots on the ground person to get the word out about the Nimble app and Nimble Science. And so with that being said, like I mentioned earlier, it's a free app to all Coloradoans 60 plus. And we've been able to do this through Dr. Cog. And I'm looking for community partners, really just to spread the word about this this app and let the older adults throughout Colorado know that this is available. It's science-based. It's been very successful at fall prevention and balance training. So if anyone is interested in working with Nimble and partnering with us to get the word out, I would love it. So let me know if you have any questions or you want to email me. I'd love it.
Great, thanks, Sasha. If not, I just want to thank you all for being here. Thank you to Melissa for navigating such a great conversation and asking great questions, and we really appreciate it. And thanks everyone for joining today. Stay warm and stay well.
Good to see everybody.
Thanks,
Thanks.
Shirley.
Take care, everyone.
Thanks.
Goodbye.